Good morning, everyone. Today we are going to discuss about respiratory syncytial virus, which is very notorious virus which cause severe respiratory infections in infants and elderly population, leading to multiple hospitalizations for them and causing high morbidity. And with the recent history of lot of controversies with the vaccination, with this newly launched RSV vaccine, which is launched 1 month back in Middle East, we'll discuss about what is the safety profile and efficacy of this vaccine. Ladies and gentlemen, as you all know me, I am Dr. Zakir Husin, Pulmonologist and Critical Care Specialist at Bahrain Specialist Hospital. Today we are going to discuss about RSV. RSV is a common respiratory viral pathogen which is highly contagious. The mean basic reproduction number of RSV is 3, which means on average each infected person can infect 3 other people. This basic reproduction number is the marker of contagious property of the viral infection. For comparison, influenza has only 1.5 RO number, whereas COVID variant Omicron has 10. So which is 3 times more contagious than the RSV virus. Which is enveloped and RNA virus. It has 2 surface proteins. First one is G protein, which is a glycosylated glycoprotein, which plays a vital role in RSV attachment to the epithelial cells of the host. Second important protein is fusion protein, which is on the surface of this virus. On basis of this, the vaccination was formed, which plays a vital role in RSV fusion by forming a stable post-fusion state. Same like influenza, RSV is also classified into 2 subgroups, RSV-A, RSV-B, based on the antigenic and sequence-based variations found on the G protein. The incubation period of this RSV is 3 to 5 days, and it is spread mostly by the droplets. And once the patient is infected with this RSV, it enters through nasopharyngeal passage or through the conjunctival mucosa. Both ways it can transfer to the person. And then it goes into the ciliated epithelial cells and goes into the respiratory tract. Once it enters into the host cells, it binds through the F and G proteins and cause the replication of the viruses. There the host response will start by which is triggered by the humoral and cytotoxic T cell activation in the host, which leads to formation of highly inflammatory state, leads to respiratory epithelial cell necrosis, which leads further airway obstruction and causing necrosis of those exudates, and formation of this exudate leads to mucus plugging and causing lung compliance and leading to pneumonias. It has certain cardiovascular properties also, cardiovascular complications also. And by symptoms in infants, we do see simple upper respiratory tract infection leading to lower respiratory tract infection also, causing to croup in the upper airway. And then once it goes into the airways, there it will cause bronchiolitis, causing wheezing and breathing difficulty, which are the common causes for hospitalization in infants. Whereas in adults, mostly it will be like simple upper respiratory tract infection, which is self-limiting. In good immune person, it is self-limiting, which goes in 3 to 5 days with the basic symptoms of fever and myalgias and runny nose, sneezing, nose blocks, and cough. Those are the basic symptoms which doesn't require any significant treatment. Just supportive care is sufficient for these people. Whereas in vulnerable populations, like both extremes of age, infants and children less than 5 years, and adults more than 60 and above, for them it causes severe lower respiratory infection leading to pneumonia. And even in certain chronic lung diseases, patients with asthma and COPD, it is notorious to cause acute exacerbations. And even in CHF patients also, it will cause decompensation leading to cardiac complications. It has a huge burden on older people. And there's one study in pre-COVID era, 2019, they conducted among adults 60 years and above. There were almost like 5 million acute respiratory tract infections with the RSV, leading to almost 5 lakh hospitalizations in a year. Among them, almost 33,000 deaths happens because of RSV. That is the reason we need vaccination for this disease. with the advanced age, what happens is there will be decline in the immunity in the older population. So they are more susceptible to get a viral infection, especially RSV. And people with even younger adults with underlying comorbidities like diabetes or other kidney diseases, they are more risk of getting severe RSV infections. And the combination of elderly people with comorbidities, like most of the elderly people will have diabetes and CKDs and other cardiac problems, they get severe outcomes. They get high risk of severe outcomes, like leading to hospitalizations, leading to ICU admission, and some people may may succumb to death also. These are the indications for going for vaccination. Even in adults with the respiratory comorbidities, especially like chronic lung diseases like COPD, the US study, they found that among the COPD patients, there is a 13 times more risk of hospitalization with the RSV alone. Among the hospitalized patients, almost 80% of them had acute exacerbation during the admission time. And same goes with asthma, which leads to 4 times more risk of getting hospitalization with the RSV infection, leading to 50% of the people developing acute exacerbation. Each exacerbation will decline the further lung power, lung functions to 50 ml per exacerbation. That is the reason it's always better to avoid infections in patients with the lung diseases. Whereas adults more than 18 years with the underlying metabolic problems and cardiovascular diseases, a study found that CHF patients are 8 times more prone to get hospitalization with the RSV. And with them, with this infection, they are at a high risk of developing cardiovascular complications like decompensation of the heart failure and arrhythmias, and also causing to myocardial infarctions. Whereas the most notorious disease like diabetes, which leads to high risk of pneumonia, especially uncontrolled diabetic patients with A1C of 9 and above, they are always prone to get bad pneumonias, even it's bacterial or viral or tuberculosis in endemic countries. They are prone to get severe infections. In a US study, they found that almost 12 times they are more risk of getting hospitalization with RSV alone. So controlling of diabetes is very important, and also vaccination for these people is very important to save them. The actual burden of RSV in older adults is underestimated. There was a study, they found that most of the adults were not suspected for RSV infection, and it is not done routinely. But we are fortunate here in Bahrain Specialist Hospital, we have the respiratory panel, which is multiplex respiratory panel, which will detect 15 viruses, 15 bacteria within 3 hours of the sputum sample. So we can get all the viruses which are, we are not, even if you're not suspecting also, we can get the in the diagnosis. And RSV is usually contagious to 3 to 8 days this infection. But one important finding that I learned here is the people with a weakened immune system, they can still spread the virus even without symptoms also, as long as 1 month of the disease. So that's why we should be more careful with immunocompromised people. Even if they tested negative also, they still harvest these viruses in the nasopharynx. They are still infective to other people up to 1 month of their infection. And testing of RSV is done by the antigen detection, serology, but RT-PCR is the gold standard among testing. And it is tested through nasopharyngeal swabs. The burden of RSV compared to the influenza, if you can see this forest plot, we can see even the hospitalization length of stay is more with RSV compared to the influenza. Even ICU admission is significantly high in RSV compared to the influenza viruses. Even in the pneumonia, incidence of pneumonia is high with RSV compared to the influenza like H1N1, influenza A and B. And exacerbation of asthma and COPD also is more with RSV. RSV can cause severe lower respiratory tract infection among the elderly population. In summary about this virus, this RSV can impact vulnerable population like older adults and young children less than 1 year, infants or less than 5 years, they are more prone to get severe infection. It has a high disease burden in elderly population with the risk of severe outcomes from RSV. That is the reason we need vaccination for RSV. As the treatment goes, there is only supportive care for the RSV. There is no significant treatment found nowadays. Only one antiviral, ribavirin, doesn't have that much of promising results. So prevention is always safer, better than the cure. So that's the reason there was a vaccination and monoclonal antibodies. Two options we have apart from the mask and apart from the airway precautions and droplet precautions and all those things. Vaccination is proven as safer. And this monoclonal antibodies is used only in the infants. We have two monoclonal antibodies which is approved by the FDI, which were nirsevimab and palivizumab. This nirsevimab is injectable monoclonal antibodies which acts like a passive immunization for the infants, and it is given to the premature infants, premature child who are born with preterm deliveries, and antibodies themselves protect them against the ready-made antibodies which were given by the injection, same like the monoclonal antibodies we used in the COVID, which has similar action here also. It is given intramuscular and given during the RSV season, mostly in the November to March. It has a good safety profile and also proven efficacy from the phase 2 and phase 3 clinical trials, which has shown that it has significantly reduced hospitalization with the RSV associated lower respiratory infection by 80% and significantly reduced admission to the ICU by 90%. And the only contraindication is history of previous severe allergic reactions. There are two vaccines which were approved by the US FDI. One is from the GSK. It is known as RSV. It is the adjuvanted vaccine. Another vaccine is from the Pfizer, which is an unadjuvanted vaccine, which is a respiratory Abrysvo. These two vaccines were approved by the US FDA exactly 1 year back. Nowadays, we have in Bahrain and also in the Saudi, in almost all GCC countries, these vaccines are available. Mostly GSK RSV vaccine is available in all the Middle East. Among the vaccines, only Pfizer vaccine was given approval for the infants, where that is given in pregnant ladies in 32 to 36 weeks of gestation. Previously, they were suggested to give this vaccination from 24 weeks, from second trimester to third trimester, but there were certain premature births. So now they strongly suggest to give vaccination from 32 to 36 weeks of gestation. These maternal antibodies, IgG, will go into the fetus, will cause passive immunity in infants up to 6 months to 8 months of the age, at that age they are more prone to get infections. It is given to the mother, but for the sake of kid, it is given to the mother. GSK vaccine has more premature births in the developing countries in the trial. That's the reason FDA has not approved this GSK RSV vaccine for pregnant ladies and infants. It's only approved for elderly population 60 years and above, whereas the Pfizer vaccine is approved in pregnant ladies and also elderly population 60 years and above. This is an interesting article published in NEJM in February 2023 about safety profile, which has an acceptable safety profile of preventing RSV-related acute respiratory tract infection and lower respiratory tract infection in 60 years and above people. So after this, US FDA has given the clear permission for this vaccination, and most of the some of the countries have given their recommendation for routine vaccination in general population. Especially US has given more than 60 years of age for all the general population this vaccination approval, whereas the UK NHS, they have given 75 years and above only, whereas certain Scandinavian countries like Norway and Sweden, they have given only 60 years and above with underlying conditions to go for this vaccination. This RSV vaccine will induce a cellular immune response. It has an adjuvant that will boost the immune response, which is less in elderly people. Elderly people, because of their low immunity, they cannot mount proper immunity with the vaccination. That's the reason this adjuvant is used in certain vaccines to boost that response. This RSV induces specific cellular immune response, leads to which enhance antigen-specific cellular immune response and neutralizing antibody response in individuals with pre-existing immunity against RSV vaccine. This adjuvant that is used here in GSK vaccine helps in recruitment and activation of antigen presenting cell carrying vaccine derived antigens in elderly population. What is the safety profile of this RSV GSK vaccine? As per the trial that we published in NEJM in 2023, there was a big study of 12,000 people in each arm. There's a double-blind randomized control study with 12,000 people in control group and placebo, 12,000 in placebo group. They found that there's a primary endpoint was to prevent this respiratory infections, and secondary endpoint is in the elderly with the comorbidities, hospitalizations, and all those things. It was done in almost all the races like blacks, Asians, and other people, and both in geographical northern and southern hemisphere also. The findings were very much promising. There's a good efficacy with this vaccine, almost 82.6% efficacy with preventing severe lower respiratory infections. And also people with the comorbidities, pre-existing comorbidities more than one, they have 94% efficacy in preventing the severe infections. And even in elderly population, 60 to 69 years, there was 81% efficacy in preventing infection, which is more than 93% in 70 to 79 years old in preventing severe lower respiratory tract infection leading to hospitalizations. Even with the people with the comorbidities, almost 94%, and people with the diabetes or other endocrinology abnormalities, there's 100% protection in avoiding severe respiratory tract infection leading to ICU admission or other major complications. And this is Pfizer one is a bivalent vaccine which takes care of RSV A and RSV B, whereas the GSK vaccine is they're not specific, but it has shown that efficacy almost 84% in A and 80% in RSV B variants. And almost all the vaccines have side effects, but compared to the placebo, definitely with RSV, there was certain side effects which are very minimal. That's why it has a good safety profile, except for pain at the local area and erythema and slight swelling. There was not that significant side effects. Almost all the vaccination have the risk of less than 1% of Guillain-Barré syndrome. Even this Pfizer and GSK vaccine also had the similar thing. Less than 1% of having GSK and other demyelinating diseases. The summary of this vaccine is the primary endpoint overall efficacy in protecting adults 60 years and older, almost 82.6% efficacy of this vaccine to prevent severe lower respiratory infections. And patients with comorbidities, there is a 94.6% efficacy in preventing hospitalization and ICU admissions in patients with the severe comorbidities. It has a good safety profile, so it is very safe for administrating. That's the reason many bodies, many guidelines were there. Even the CDC has recommended it's worth having a conversation with the patients 60 years and above to go for vaccination about the RSV. The GOLD guidelines, which is famous body for the COPDs, they also recommended strongly level A evidence recommendation for going for vaccination for COPD patients with or without heart diseases. And even the GINA guidelines, which is famous for asthma, they also recommended strongly for going for this vaccination for elderly population 60 years and above. Even American Diabetic Association also strongly recommends to go for vaccination with the patients with the metabolic complications, even with diabetes and other complications, other comorbidities. A lot of people ask about the co-administration of the vaccination. There were some good studies in this GSK. They showed that there is no evidence of interference between the influenza vaccine and RSV. Both can given with the same time. But still, if it is an inactivated, unadjuvanted quadrivalent vaccine, we have to give in the same time. If it is an adjuvanted vaccine, we should avoid. If you know, the GSK also has adjuvanted vaccine for elderly population, shingles vaccine, which is having same adjuvanted properties. So we should not give the same vaccine within the same time. At least 2 weeks gap should be given between the Shangrix adjuvanted vaccine with this adjuvanted GSK RSV vaccine. And it is always safer to give 1 week or 2 weeks gap between other influenza vaccines and other vaccines between this RSV vaccine. This vaccine has two vials. One is with the suspension, another one with the lyophilized antigen component in the powder form. So this liquid is taken in the syringe and mixed with the powder, and we should shake, and after reconstitution, we should give IM. Older adults and those with certain comorbidities are at increased risk of morbidity from RSV infection. It has a high efficacy in preventing severe lower respiratory infection in elderly population 60 years and above. And it has a acceptable safety profile compared to other vaccination. Almost the phase 3 trials shows that it has a good safety profile. Thank you for your patient listening. Any questions, please?
Thank you very much. I would like just to add a few words, if you don't mind.
Yes, sir, please.
The fortunate thing is that Bahrain NHRA has approved the Pfizer RSV vaccine just a few days ago. And it was a record that within about 6 days of applying, it was approved. And that is really a reflection of the immunization committee of the Ministry of Health pushing for this thing. And I'm very happy that it was approved that quickly. Now, there are significant differences between the RSV vaccine of Pfizer and GSK. The one that was approved by the ministry, by NHRA, is the Pfizer vaccine, which is a bivalent vaccine, A and B. There are some differences between both of them, and the approval of NHRA for the Pfizer vaccine was for elderly, older people, 60 years and above, plus pregnant ladies between 24 to 36. So it's not 32 to 36. So Bahrain was a little bit more liberal in providing it to an earlier time during pregnancy. And the significance of that is that if you wait till 36 weeks of age, you are not going to be able to protect the babies who are born at 37 or 38 weeks, because it takes about 2 weeks for the antibodies to be formed and transferred. So giving it earlier than 36 weeks is always a big advantage. So this is another point which is in favor of Pfizer. The other point that's in favor of Pfizer is that there are studies enough to prove efficacy after 2 years of the vaccine. So far, it is recommended once only. The GSK does not have the reach of 2 years after the vaccine follow-up. So in the Pfizer vaccine, after 2 years, there's still demonstrated preventive infection of RSV. Of course, one thing that we do not know is that whether do we need another booster maybe after 3 years. But so far, it is only one dose. And Bahrain recommended it for elderly people, I would say people above 60, and for pregnant ladies between 24 to 36 weeks of age. And this is something which is going to be available very soon, and it's going to be made available in our hospital as soon as it becomes available. And if there are any more sort of recommendations from the immunization committee of the public health or the NHRA, I will definitely send them to you as soon as I receive them. But this is very fresh news that RSV vaccine, as a matter of fact, it is approved in almost all of the Gulf states. And the Pfizer won the race, so to speak, for approval in the Gulf region, as you mentioned, in the UK, US, etc. So this is sort of something which is evolving very quickly, and the need is very clear. Adverse events, you are absolutely right. There are no serious adverse events when you compare to placebo. Mostly the concern about pain at the injection site, and between placebo receivers and the vaccine, even that does not show any remarkable difference, except for the local sort of pain at the site. So we are expecting it to be available. The only thing that we are waiting for is approval for RSV vaccine in younger adults and older adults who have underlying disease, whether it is chronic kidney disease, diabetes, or are on immunosuppressive medications, etc. This has not been approved yet, but it is going to be happening very soon following FDA approval. So all of these things indicate very significant points that will help our population. And as you mentioned, the severity is really much more important to keep in mind in lower tract infections in adults that occur after sort of a similar, simple appearing upper respiratory tract infection. So hopefully this will be a very good thing for giving to our population as it is being given everywhere else in the world. If there are more questions for Dr. Zakir, please go ahead and ask them.